We've now got Scarlett McNally, who's going to come and talk to us. Thank you. Scarlett is the orthopaedic surgeon for Deputy Director for the Centre of Peri-Operative Care and Bespoke. Sorry.
So, hello, it's so lovely to see people here. I've been an Eastbourne resident for 22 years. I work at the DGH, and I've got various other things. I'm going to talk very, very fast. I have no conflicts of interest. The only people that pay me any money is East Sussex Healthcare NHS Trust. I've got a column in the BMJ, and I donate that to the Medical Women's Federation, where I'm currently president. I've been involved in various things. The UK Health Alliance on Climate Change has been going for about 15 years. It's organisations that are trying to get health better. This is kind of past me. I'm still operating. I'm working half-time now, which is lovely. It's the best job in the world. I use that picture because I do a lot of talk on diversity. That kid's now first year at uni. So I was pregnant when I was operating, and I was on the Council of the Royal College of Surgeons for 10 years. It's now again much more diverse, but we did a lot of stuff behind the scenes. So I'm trying to tell you I'm very, very important because it's not always completely obvious. So I put this slide up when what's the most dangerous activity you can do? Anyone? Because this is what I do all the time. You break it, I'll fix it. I love it. It's great. Tell me, anybody? Thank you. Thank you. You've seen these before. Sitting down is the most dangerous thing you can possibly do. Being sedentary, it's absolutely lethal. So cars, computers, all that stuff. Smoking is the other one I would accept. And basically, you think it's genetics, it's not. 20% of ill health is caused by genetics. So, you know, your granny lived till 90, actually, you're not protected, mate. And actually, the biggest cause, I'm going to go back one. I'm going to try and go back one. There we go, thank you. This is the deprivation indices. So you're 2.5 times more likely to get heart disease, which is the light green, or cancer, if you're in the most deprived area than the least deprived area. And that's completely unfair. And you can see it's a dose-dependent curve. This isn't just some random aberration. This is what causes people to be ill. Nothing about me fixing it or just giving the tablets. This is what ill health is. And what actually causes it, you can talk about poverty, you know, it's really difficult to fix, we haven't got any money, blah, blah, blah. But actually, what causes it in the human beings, why you move a kid from one postcode to another postcode, what makes them different? It's smoking, nutrition, physical inactivity, alcohol, and pollution. Those are the biggest ones. Yeah. And those are the ones where actually you need to think about working and improving people's lives and stuff. So I was lead author for this, representing the Royal College of Surgeons of England, but I led on it for the Academy of Medical Royal Colleges. It's all the medical Royal Colleges and Royal College of Nursing and Faculty of Public Health. You can still get it. The best copy's on scarlettmcnally.co.uk because it's kind of carefully hidden on the academic, because it was 2015. We weren't talking about physical activity then, but now we do a lot. And this, feel free, get your phones out, take pictures. It's none of it's copyrighted. If you do exercise at a dose of 150 minutes a week, you reduce your risk of dementia by 30%, 30%. Why isn't everybody doing it? You know, stroke, 30%, all these things, type 2 diabetes, depression. Why aren't we doing this? If this was a tablet, everyone would take it, wouldn't they? So the middle column is, does it treat it? Because we talk about primary prevention. Everyone thinks, oh yeah, that's for later. But actually, it treats those conditions. If you've got type 2 diabetes, you're less likely to get kidney failure if you do your exercise. Yeah? So that is the treatment. It's the tertiary prevention. It's the getting people better when they've started to have something, that teachable moment often. And the lifetime risk, just to show you, those are really, really common conditions. Yeah. And it's not me saying that. It's all this is stuff out before 2015. National Institute for Health and Clinical Excellence, Public Health, everybody says it, but no one actually does it. So this is your chance to do it. And this is from the Global Burden of Disease in the Lancet. This is for the UK. You can see I've circled physical inactivity and low physical activity, the fourth leading cause of disability adjusted life years. Yeah, so you can get it. All the other ones are things like diet low in vegetables, drug use, all that stuff. So and this is how many conditions people have. All those conditions we talked about that are really, really common. 1 in 4, the Richmond group, I was at their launch last week. 1 in 4 adults in the UK have multiple conditions, 2 or more conditions. This is the age going up that way. I've put the line in age 65. You can always think of someone age 65, yeah? So this is no conditions in blue, and gradually you get more and more. It should really be 3D and social deprivation as well, but 50% of people at the age of 65 have multiple conditions, and this is what is costing the NHS loads of money and all your taxes, because it goes up and up and up with age. So exercise is great, yeah, because the best bit about it is just getting up off your sofa and having a bit of a wiggle reduces your risk. So the reduction in risk, and we talked about reducing 30%, that's reducing from 1 to 0.7, yeah. So this is the amount you do in intensity and time, met hours per week. Just getting up and doing something massively reduces your risk. So we need to get people that are doing nothing, doing something, going for a walk, climbing stairs, getting on a bike, just getting us something. And it has, there we go. It has a different effect on different things. There's the breast cancer one, it's a bit slower effect. So again, this is a slightly different scale. I put the arrow at 150 minutes a week of moderate activity. And that reduces your risk of different things at different stages. So these are, you know, you want a graph, you get graphs. It's there's loads of them out there like that. This works, but the critical thing is we need to tackle the people doing nothing, not tackle, you know, lift, be nice, support. Because 1/4 of UK adults do, this is no exercise at all. That's less than 30 minutes a week. You know, not the us lot all doing 150 minutes a week, God, we're so smart, but this, and 47% of over 65s do no exercise per week. We need to get people out and doing stuff. And sedentary is bad, exercise is good. You can have the slides later for all this stuff, but basically it's not just, you know, burning off the calories. It has a metabolic effect, which is why it manages blood sugar and type 2 diabetes and stuff. It has an inflammatory effect, which is why it reduces the recurrence of cancer. It has and if your legs are strong, you can get to the toilet and you don't need social care so much, yeah, and you can get out of your hospital as a day case. This is from, anyone see the Chief Medical Officer's report last week that came out? So this is Chris Whitty. So this is the map, and the dark blue is the percentage of when you've got areas with 25% of the population aged 75 years or older. So that's 20 years away. Yeah, that's a lot, a quarter of the population. So we can't possibly have people being as inactive as they are because we simply can't afford it. And this is, again, he's got that curve the other way up. Just doing a bit improves the health benefits massively, yeah? And it tails off. After an hour a day, you're a bit weird, to be honest. Active travel, it's 250 pages or something. But the active travel bit, if you just Control F and put in travel, enables older adults to embed it into their day. This is what we need to create the places, terrain of walking past so they don't trip because they're scared. I sit there and fracture, oh, tripped over the pavement. I don't think I'll sue, doctor. It's like, you know, but yeah, we'll sort you. Do you know what I mean? It's kind of, they're scared to go out, and we need to change that. Being physically active throughout the life course delays the onset of health. I wrote this in 2017, saying if we can get people to be active, it will reduce the need for social care. Because if you can get to the toilet yourself, you don't need to pay for a living carer or to go into a residential home. And I thought everyone would be great. That's great. We can prevent the need for social care. We're each predicted to need 10 years of social care on average. Obviously, none of us are average. It's in the socially deprived groups. And of course, no one read it. No one did anything about it. But it's there. It's on my website, Scarlett. And you can think about that curve. If you stay active, you don't dip below the line where you need care or where you have an illness that then makes you worse. So we need to keep everybody staying above the line. And again, Chief Medical Officer said this is life expectancy, but it's not just that people in the 10% most deprived areas have a shorter life. It's that they spend 26 years of it in poor health, whereas in other areas, it's only 15 years. And that is the bit, just to be callous, that's the bit we're all paying for that was unnecessary. Yeah? So to do change, we all think we're amazing, we're going to do everything. Anyone have New Year's resolutions ever? Yeah, stick to them. Bit difficult because we're so busy with our things. We need to know the stories. We need to know data. And Daryl Gales showed lots of things. But we also need the how. We need the practicalities. So I've got waterproof trousers in the pannier of my bike outside. I cycle to work. If it's raining, put the trousers on. Not a biggie. Yet we need to make everything so it's not a biggie. These are the practicalities. And we need the NHS to lead on this. And it's basically, we all know about the dopamine hit when you do something nice. This is the orthopedic surgeon's guide to brain chemistry. This is why we do anything. Yeah. But we need to do it together. If you sign up for charity run, charity walk, you say you're going to cycle to work on Fridays or whatever, you will do it if you stick to it, if it's in your regular thing, because we need that, we need the mini rewards and stuff. And if you do it together, if you do a good deed, you actually get that buzz from the oxytocin. Your endorphins take 20 minutes to work, so I tell my patients to have running shoes by the front door, so they actually get out, because you've got to get over that inertia. And here's some numbers. Feel free to take pictures. 62% of UK adults say it's too dangerous to cycle. Only 3.5% of walking journeys are over 2 miles. So it's difficult. If you're trying to get that modal shift, you need to get the cycling and the buses and the trains or whatever, because people don't walk the long distances. And 34% of children are driven to school by car. Free and generous parking availability quadruples the chance of driving to work. There's all there. And people who cycle to work, 40% reduction in cancer and in heart disease. Again, this is from the World Health Organization. Because we just said what would make the world healthier? It's diet and physical activity. So they've said these are the things to do: active travel, space for recreation, walking and cycling, commuting. It's duh. I'm just saying this is not complicated. This is from the chief medical officer, the previous chief medical officer's guidance on 150 minutes for all adults. You're not exempt. I've put up the infographic for people with disabilities. They should be aiming for the 150 minutes. So we need to keep the swimming pools open and all that stuff so people can get out, do stuff. And for frail older adults, the sit to stand exercise, walking up and down stairs, walking around the block, anything, just to keep your heart and lungs going, and some strength and balance training. This is from the British Medical Association. I've been hassling them. I was on a couple of committees there in the past, trying to get them to relaunch it. But anyway, the best forms of exercise, they fit into everyday life. You need it in that habit. You need it as just what you do. When it's November and it's, too wet to go play football, you just cycle to work, These are electric bikes are amazing. The evidence is coming out now that people are just as fit with an electric cycle because they convert more car journeys to it. That was measured, that was for 10,000 participants, that first reference. Those are my 2 bikes I had at the time. You just plug them in like your phone, you just charge them. It's not difficult. And if people who loan, so any of you running businesses, loan electric bikes, you save the money in the sick leave because people are so much fitter and they love it. And you arrive at work when the endorphin hits you, which is the natural opiates, and you just feel calm, and it's lovely. The benefits to health outweigh the risks by 10 to 1. People talk about pollution, they worry about collisions, but actually 10 times the benefit. Pollution we've talked about, it's not just asthma, it's cancer, and it's poor cognition means dementia. Yeah? And the pollution is a significant problem. And it's not just what comes out of the tailpipe, it's the particulate pollution from the brake and tyre wears, it causes about half the damage. They're tiny little particles, and they get between the cells in your lungs, go straight in and have a very nasty inflammatory effect, which is probably the effect on the cancers. This is from the old Joint Strategic Needs Assessment, but I'm just saying East Sussex is an outlier for being bad, for people getting killed and injured on the road. It's often children at start and finish of the day, and the action suggested it introducing 20-mile-an-hour areas. We don't necessarily need the I'll keep talking. So this is what I'm working with the Centre for Perioperative Care. They pay East Sussex Healthcare NHS Trust for half a day of a week of my time. We can reduce complications. 10 to 15% of operations will have a complication, even if you think you're brilliant. 4 times higher if people are physically inactive, 5 times higher if they're frail. We're working on trying to get the population healthier in these long waiting lists so that we can get people to be day cases, which is much more efficient, and so they don't have complications, which keeps them in hospital. We've been working with Macmillan, prehabilitation for people having cancer treatment. They get through it better, fitter, better, sooner, teachable moment. This is from the Lancet on if people are doing exercising, getting outside, just fresh air, just green therapy, blue therapy. It's a thing. It really exists. It's in the Lancet. It's not. These are a couple of things I've written. It's about sustainability because there are lots of operations that didn't need to happen. Some people with knee arthritis would be better doing some controlled exercise and wouldn't need a knee replacement. All those consumables that go in and all that sort of thing, and the complications that then need to back to operation in intensive care, all that stuff, we can reduce the risk. So yeah, win-win for sustainability. It's like, how many numbers do you want? It's all there. This is from the Centre for Perioperative Care. It's largely funded by the Royal College of Anaesthetists, cpoc.org.uk. Amazing stuff on there. 50% reduction in complications if we can get people to do stuff before their operation. saves, loads of money. And so basically we can either do this because it's nice, because we're nice people, we want people to have a nice life and lovely, interact with other humans and it's great, or because we absolutely cannot afford it. We can't afford what's coming. I'm a doctor, I'm lucky, but we've got 6 million carers in the UK, half the East Sussex healthcare NHS revenue budget goes in adults. We can't afford this. This is about the little grey dots are 1% of people's, as it were, and the area on the curve is the amount of money. 45% of hospital spend is on 3% of patients. Yeah? So those are the people who it matters for everybody. Nobody's beyond. This is from the East Sussex, the revenue budget for East Sussex County Council. That's our council tax, people. Half of it on adult social care. And 27.7% of people in this county are working in education, public administration, health or social care. And everyone's working very hard and it's impossible and people are under amazing stress and there's burnout and all that stuff. But if the population wasn't so inactive and unhealthy, you wouldn't need quite so many social care workers. Just floating that to you, because I'm a nice person. I do it because I think people need to know. Collisions. This is collisions of pedestrians hit by cars. 142 in 5 years. Just imagine those knock on the door, those families affected, the school, just horrible. Yeah. And it's only 5 miles across. It's easily cyclable or bus. This is what East Sussex is planning to do with the pedestrianisation. I just warn you that those areas in pink that currently have motor traffic would be far better with a two-way cycle lane, so that people can permeate between, so you can go through slightly quieter roads. If that's all pedestrianised, no one's going to make that modal shift if they're pushed onto the busy ring road. You need to have the pink bit should be two-way cycle lanes. I'm begging you. This is from thank you. This is a report from which Bespoke and the Eastbourne Chamber of Commerce both contributed an independent report about what to do about the seafront. You see those parked cars where the promenade's narrow, it's suggesting two-way segregated cycle route instead of those parked cars for that section where it's narrow. Yeah? And that would work. What else solution is there? This is an independent report. It's on the Bespoke website. This is, like I say, I've got a column in the BMJ. This is from that. You can access it. In Edinburgh, when they introduced 20 miles an hour limits across the town, road traffic casualties, that's people injured in any kind of collision, reduced by 40%. Because the traffic's moving slower, so the injuries aren't so horrible. But here we got the funding all wrong. People petitioned for something, a pedestrian crossing outside their school. It goes on the list of 79, and only the top 3 have funding. So yeah, all of these angles, exercise, pollution, all that stuff. What can you do today as a car driver? Give that 1.5 meters. I wasn't sure if I was going to do it. I'm just going to do that. This is 1.5 meters. Yeah, it's in the highway code. If your wheel is there and you're overtaking me and my wheel is there, that's the distance. If you cannot do it, don't overtake, you hang back, you look like a muppet. Oh, why are you driving slowly, mummy? You look like a muppet, but you allow that might be wobbling on their first bit to being active. Yeah, that's what 1.5 meters means, 5 foot. Yeah, and they're allowed to arrive in the centre. They're a vehicle. They're allowed to ride in the road. People don't know that, so we need to. This is from Salisbury. I have a loan scheme. They're great. This is me. I was actually horribly ill about 5 years ago. There's still a video on YouTube somewhere, and I had myeloma, which is cancer of the plasma cells. My heart was constricted by all this floating around stuff. I couldn't walk up 3 stairs, which is why I got so good on Twitter at Scarlett McNally. 3 stairs, play on phone, 3 stairs. Got an electric bike to get out to do it because I was told I wasn't fit enough for stem cell transplant. Got fit for stem cell transplant, and I'm back at work part time. Yeah, this is what we need, people. So it's a personal story, but stories make change. Yeah, this is my final slide. Thank you very much.
Thank you, Scarlett. As I said, my job's chair to try and keep everybody on time, so I'm failing at that terribly. But I think that the health is the background for everything that we're trying to do today. Some short-term investment in our local transport system will have long-term effects, not only for the local government, but for central government as well. So with that, moving on to Lisa Simmons and John Wheeler.